Abnormal vaginal bleeding refers to bleeding which deviates from the normal menstrual pattern in terms of the amount, duration, or interval. So, abnormal menstrual patterns and bleeding are common in young adolescents and women within the ages of 45 to 50 years. And no cause may be found on investigation in these age groups, as it is mostly due to immaturity or aging of the ovaries and its pituitary controls. The bleeding may be mild or severe and life-threatening. In other age groups, the causes are multiple and may be associated with the identifiable disorders. The post-menopausal bleeding is said to occur when a woman who has stopped having menstruation for 6 to 12 months or more months begins to bleed per vagina. And occasionally, bleeding from the rectum and urethra may be confused with genital tract bleeding. The treatment is directed at the cause which is found. The causes for pre-pubertal girls include urethral mucosal prolapse, also coital lacerations due to rape and defilement. It could be from trauma. Young adolescents, the causes are dysfunctional uterine bleeding, complications of pregnancy, coital lacerations due to rape and defilement, and accidental traumatic ablations of vulva and vagina. For women of childbearing age, it could be from complications of pregnancy, including ectopic pregnancy, abortion, and choriocarcinoma, coital lacerations, use of hormonal methods of contraception or intrauterine contraceptive device as IUCD, cervical cancer, fibroids, and dysfunctional bleeding. For perimenopausal women, the causes are dysfunctional uterine bleeding, and all other causes for women of childbearing age also apply. For postmenopausal women, causes are pelvic cancers such as cervical cancer, endometrial cancer, vaginal or vulvar cancer, and ovarian tumors. Withdrawal from estrogen therapy too could cause it, and also atrophic vaginitis, endometritis, coital tears, and urethral carancel. So the symptoms are vaginal bleeding, which deviates from normal menstrual pattern, may be associated with lower abdominal pain or dysmenorrhea. Symptoms of anemia could be present with dizziness, palpitations, easy fatigability, among others. The signs that are usually elicited are signs of anemia, as if heavy bleeding, and other signs related to cause. Investigations are FBC, Sickling test, and other signs related to cause. So signs of anemia, if heavy bleeding, and other signs related to the specific cause. Investigations are FBC, Sickling test, blood clotting screen, for example, prothrombin time, INR, pelvic ultrasound scan, to rule out pelvic lesions, urinalysis, diagnostic dilatation and curettage, SADNC, for women of childbearing age and postmenopausal women. The main treatment objectives are to resuscitate patients where necessary, to find the cause of bleeding, and to treat and stop the bleeding. Non-pharmacological treatments, vaginal coital tear, suturing in theater, inevitable or incomplete abortion, uterine evacuation, surgery, myomectomy, hysterectomy, oophorectomy, among others. So radiation therapy for cancers. Or pharmacological treatments for dysfunctional uterine bleeding, as mild bleeding. The first line treatment, we give norethistérone acetate. So you give oral 5 milligrams 8 hourly for 10 to 12 days, and that's to stop the bleeding, and then 5 milligrams 12 hourly days 19 to 26 of the cycle to prevent bleeding. So second line treatment, you give mefenamic acid oral 500 milligrams 8 hourly on days 1 to to 5 of cycle, especially if associated with dysmenorrhea. Life-threatening bleeding, first-line treatment, you give IV fluids and blood transfusion as required, and then you give tranexamic acid oral or IV 1 gram 6 to 8 hourly for 4 to 7 days. Second-line treatment, you give mefenamic acid slow IV injection 500 milligrams 8 hourly, days 1 to 5 of the cycle. Or you can, for recurrent or protracted abnormal bleeding, first-line treatment, you give low dose oral contraceptive pill daily for 3 to 6 cycles or longer. So you give drug combinations. You can give ethinyl estradiol plus levonorgestrel. So ethinyl estradiol plus levonorgestrel, or you can give ethinyl estradiol plus norethistérone. So second line treatment, you give conjugated estrogen oral 1.25 to 2.5 milligrams daily for 10 to 12 days, and then you give norethistérone oral 5 to 10 milligrams 8 hourly for 21 days. That's days 5 to 25. You can give it, or you can give medroxyprogesterone acetate oral 5 to 10 milligrams daily for 5 to 10 days. So days 19 to 26 of the cycle. The referral criteria: you refer all women with heavy menstrual bleeding or abnormal vaginal bleeding not responding to therapy to a gynecologist for comprehensive assessment and management.